Cystic fibrosis. Cystic fibrosis or CF is a genetic disorder that primarily affects the lungs, pancreas, and digestive system. It is caused by mutations in the cystic fibrosis transmembrane conductance regulator or CFTR gene, which encodes for a protein that regulates the movement of salt and fluids in and out of cells. In people with CF, the cystic fibrosis transmembrane conductance regulator protein is defective, leading to the production of thick, sticky mucus that clogs the airways and makes it difficult to breathe. This mucus also blocks the ducts of the pancreas, preventing digestive enzymes from reaching the small intestine and leading to malabsorption of nutrients. Cystic fibrosis symptoms. Cystic fibrosis can cause a range of symptoms, which can vary from person to person depending on the severity of the disease. Common symptoms of CF include 1. Respiratory symptoms. Thick and sticky mucus clogs the airways, making it difficult to breathe. This can lead to chronic coughing, wheezing, and shortness of breath. People with CF are also prone to frequent lung infections, which can cause further damage to the lungs over time. 2. Digestive symptoms. The thick mucus can also block the ducts of the pancreas, preventing digestive enzymes from reaching the small intestine. This can lead to malabsorption of nutrients, resulting in poor growth and weight gain. People with CF may also experience frequent greasy stools and abdominal pain. 3. Reproductive symptoms. Cystic fibrosis can affect the reproductive organs, causing infertility in males. Women with CF may also have difficulty getting pregnant. 4. Other symptoms. Cystic fibrosis can also affect other parts of the body, such as the liver and sweat glands. People with CF may have a salty taste on their skin due to excess salt in their sweat. Symptoms of CF can vary widely depending on the age of onset and severity of the disease. Cystic fibrosis causes and risk factor. Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane conductance regulator or CFTR gene, which is responsible for producing a protein that regulates the movement of salt and fluids in and out of cells. These mutations result in a defective cystic fibrosis transmembrane conductance regulator protein that leads to the production of thick, sticky mucus that clogs the airways, pancreas, and other organs. Cystic fibrosis is an inherited condition, meaning it is passed down from parents to their children. To inherit cystic fibrosis, a child must receive 2 copies of the mutated CFTR gene, one from each parent. If both parents carry a single copy of the mutated gene, there is a 25% chance that their child will inherit 2 copies of the mutated gene and develop cystic fibrosis. Some risk factors for cystic fibrosis include 1. Family history. Having a family history of cystic fibrosis increases the risk of developing the condition. 2. Ethnicity is more common in people of European descent. 3. Gender affects both males and females equally. 4. Age is usually diagnosed in infancy or early childhood, but some people may not be diagnosed until adulthood. 5. Other medical conditions. Certain medical conditions, such as chronic pancreatitis, may increase the risk of developing cystic fibrosis-related symptoms. Not all people with cystic fibrosis have a family history of the condition, as some cases may be due to spontaneous mutations in the CFTR gene. Cystic fibrosis diagnosis. Cystic fibrosis can be diagnosed through a combination of clinical evaluation, imaging tests, and genetic testing. Clinical evaluation. A doctor may perform a physical exam and ask about symptoms to evaluate for possible CF. Respiratory symptoms, digestive symptoms, and a history of recurrent infections may suggest cystic fibrosis. Imaging tests. Imaging tests, such as chest X-rays and computed tomography or CT scans, may be done to evaluate lung function and detect abnormalities. Sweat test. The sweat test is a simple and non-invasive test used to diagnose cystic fibrosis. The test measures the amount of salt in sweat, which is typically higher in people with CF due to the defect in the cystic fibrosis transmembrane conductance regulator protein. A small amount of sweat is collected from the skin using a special device, and the salt level is measured. Genetic testing. Genetic testing can be done to identify mutations in the CFTR gene that are associated with cystic fibrosis. This testing can be done before or after birth and can help determine if a person is a carrier of the disease or has CF. It is important to diagnose cystic fibrosis as early as possible, as early treatment can help manage symptoms and improve quality of life. Cystic fibrosis treatment. While there is no cure for cystic fibrosis, treatment options are available to manage symptoms and improve quality of life. Treatment plans may vary depending on the severity of the disease and the specific symptoms experienced. Here are some of the treatment options for CF. 1. Airway clearance. People with CF may use devices such as chest physiotherapy, vibration vests, or nebulizers to help loosen and clear mucus from the lungs. 2. Medications. Medications may be prescribed to help thin mucus, improve lung function, or treat infections. Some medications may be taken orally, while others may be inhaled. 3. Enzyme supplements. People with CF may take enzyme supplements to aid in digestion and help the body absorb nutrients. 4. Nutritional support. A diet high in calories and protein is important for people with CF to maintain a healthy weight and get the nutrients they need. 5. Lung transplantation. In severe cases where lung function is significantly impaired, lung transplantation may be necessary. 6. Clinical trials. People with CF may be eligible to participate in clinical trials of new treatments or therapies. In addition to these treatments, regular follow-up with a healthcare provider is important for people with CF to monitor symptoms and adjust treatment as needed. It is also important for people with cystic fibrosis to avoid exposure to infections and other irritants that can worsen symptoms. Cystic fibrosis can lead to a number of complications, including depression and anxiety, respiratory complications, digestive complications, diabetes, infertility, osteoporosis, and sinusitis. Although cystic fibrosis is a severe condition that needs daily care, there are many ways to treat it, and there's been a great improvement in those treatments over the years. People who have cystic fibrosis now can expect to live a much longer life than those who had it in the past.